Careers in exercise and sport psychology. So this subfield focuses on two types of themes. One is athletes and how to help them achieve maximal performance. The other aspect, though, of health, of sport and exercise psychology, is just in general, for people in general, how they can use sports and exercise to improve their health, improve their psychological well-being. So these are the two main areas. It's not the case that everyone in sport and exercise psychology is working for the Browns or something like that, or some sports team. More often, they're going to be focusing on the second theme here. The most common employment positions are going to be academic positions, where people are professors or private clinical practice. If you do go into an academic position, it's typically not going to be in a department of psychology. It's more likely to be in a department of kinesiology, someone who's an academic who's working in exercise and sports science, or who's getting a degree in that area. So people who are in this field are going to get doctoral degrees. It's an interdisciplinary field, right, where people are going to take coursework in, physiology and kinesthetics and psychology. There's a lot that goes into it. If you're interested in finding doctoral programs, you can look at this source here, Directory of Graduate Programs in Applied Sports Psychology. If it is an interest area of yours, in terms of the undergraduate level of training, it'll be helpful to get a double major in psychology and exercise science. And if you want to work in this area with a bachelor's degree, we have some options here. One really fun job is a rec therapist at hospitals. When I worked at the psychiatric hospital for my internship, we had recreation therapists, and they were like the funnest people. They were like come around. They had guitars. They played music. They like color and paint and like sing songs with the patients. And it was a pretty cool job. So if you're an artsy person, you might like doing something like that. Okay, and now we'll take a couple minutes, reflect. Any of these careers appeal to you? Okay, careers in health psychology. Health psychology conceptualizes health. Basically, the idea behind health psychology is there's a lot of different factors that go into one's health, not only biological factors, but also psychological and sociocultural ones as well. We call this influence of multiple factors the biopsychosocial framework of health, right? It's biological, psychological, and social factors that interact with one another to influence somebody's health. And so health psychology is somewhat interdisciplinary field, in that it's health and psychology mixed together. See my great descriptions. Health psychology is health and psychology mixed together. Anyway, so there's a lot of different disorders that have mental health There's many medical problems that have psychological factors that are relevant to them. Diabetes, psychological factors can certainly come into play with compliance, with treatment. Pain has a lot of psychological factors that influence the experience of pain. So you have two people, same exact physical, biological problems, and they could have drastically different experiences of pain based on their psychological characteristics. We see several other areas where health psychologists, work with medical professionals to address some psychological consideration of these diseases. Some health psychologists, of course, do research. Others are mostly doing direct care. We have there some salaries and across different settings. What degree do you need to become a health psychologist? You need a doctoral degree, either to practice as a health psychologist or do research in health psychology. A lot of different areas that are stressed in that training, and it requires understanding of a lot of different areas of health. Although it's not the same level of interdisciplinary training like you'd see in something like sport and exercise or neuroscience. It's less intensive interdisciplinary training in health psychology. What does a health psychologist do? And again, you need a PhD or a PsyD. I'm not a practicing health psychologist, but I do health psychology research. So I'll do things like I've researched at the Cleveland Clinic. They have bariatric surgery patients, weight loss surgery patients. All of these patients are given psychological evaluations before surgery, and to identify psychological factors that could influence their compliance or success after surgery. Like if somebody has substance abuse problems, that's not a good thing, in the sense that if you give someone weight loss surgery and you shrink their stomach to the size of a golf ball and then they use substances, there's a lot of complications that arise. So people get screened for those sorts of problems, and I do research on how to predict who's going to do well after bariatric surgery. The idea being that if we could predict who's not going to do well, we could intervene before they get the surgery and give them a better chance of success. So that's some of the things that I do. Any questions about health psychology? Is this what? Oh, one of my side hustles. I thought you meant like memes. Is this one of my side hustles? No. Sort of, kind of. It is something that I've gotten grant funding for to do research in the area. But it doesn't pay me any money. So no. My side hustle is forensic assessments, primarily. It's a good side hustle because you don't have to deal with insurance companies, which are a total pain. Courts pay much quicker than insurance companies. Yeah. Yeah. I mean, they do counseling. They do psychoeducation. They do evaluations. It's just they're doing it in the context of a hospital or a medical facility, and normally they specialize, like health psychologists will specialize in one sort of disorder, like there's a one psychologist at the Cleveland Clinic who all she does is bariatric surgery patients. She does groups. A lot of times they'll have eating disorders that go along with their medical problems. She'll treat those. She'll do these evaluations. So yeah, no, they're just psychologists that are working in hospitals, basically, and treating medical patients, psychological issues. Other questions? Health psychology is a good field. It's growing pretty rapidly, along with the medical field more generally. Okay, so that's health psychologists. Careers in neuropsychology. two main areas within neuropsychology. There's the experimental neuropsychology, and then there's the clinical neuropsychology. Experimental neuropsychology, this is going to dovetail with neuroscience, just a very basic research on how the brain works, how neurons fire, that sort of thing. That's experimental neuropsychology. And then you have clinical neuropsychology, which is the application of that information to the assessment of and treatment of people with cognitive problems. So a clinical neuropsychologist is going to be doing things like cognitive assessments with people who have traumatic brain injuries to determine, well, what is the extent of this brain injury, what does it influence in terms of someone's memory, their attention, etc. So that's a practitioner job, clinical neuropsychology. And to become a clinical neuropsychologist, you need the standard training that you would get to become a clinical psychologist, plus the internship, plus an additional 2 years of specialization in neuropsychology. But it does pay better. You can be employed in either academia or practice. This is Dr. Frazier. He's a clinical neuropsychologist who also does research in experimental neuropsychology. He's a new faculty member here. Again, you need a doctoral degree, and then on top of that, in addition to the internship, 2 full-time specialization years of postdoctoral education. So I'm not a neuropsychologist, but I've done neuropsychological assessments. The way these work is you'll bring someone in, maybe they've had a brain injury, maybe they're developing Alzheimer's or some other dementia, and you'll do testing with them, cognitive testing, for like anywhere from 2 to 6 hours. So you do 2 to 6 hours of testing. You have like all of this information and these scores from that testing, and then now you have to interpret those scores and try to determine what is the issue with this person, what sort of dementia do they have, what are their cognitive deficits, and make recommendations about treatment. So those are how neuropsychological evaluations go. A lot of data in those evaluations. Some areas related to neuropsychology, of course, research assistants, occupational therapist aides, and which we saw a little bit about, and then rehabilitation counselors, and some options with a bachelor's degree. Here's some information on rehabilitation counselors from ONET, which it's a website that gives job descriptions for various different jobs. They let me see salary here and growth numbers.
Are you interested in assisting individuals with disabilities live independent, productive, and fulfilling lives? The clients served by rehabilitation counselors may have developmental challenges or a specific diagnosis, such as autism. Rehabilitation counselors help people with physical, mental, developmental, and emotional disabilities live and work as independently as possible. Rehabilitation counselors work with clients to empower them to overcome or manage the personal, social, or psychological effects of disabilities on their employment or independent living. You may work in any of the following settings: vocational rehabilitation settings, state government facilities, family and individual services, and residential care facilities. If you have the unique concern for those with special challenges, then this could be the right career for you.
Related career is occupational therapist.
Hello, my name is Joe Reagan, and I work as an occupational therapist with Select Physical Therapy here in Pensacola. Very often I'm asked what is the difference between an occupational therapist and a physical therapist. The main difference really is that an occupational therapist is going to work mainly with upper extremity and with utilizing functional types of tasks in order to achieve goals, whereas a physical therapist would use more of like an exercise-based treatment program to achieve essentially the same means, but they just may be working with different pathologies. During a typical day for me, I basically just evaluate and treat patients. I work mainly with hands, so I work with the elbow, wrist, and hand. And so a typical day would be maybe I get an arthritis patient that has had like a joint replacement in the thumb. I may evaluate that person, and based on what the doctor has on his script, I'll probably make a splint for that person, and then have them follow like more of like an active range of motion program until we can do strengthening when that's cleared by a doc or by a physician. But that's like a typical work day for me is between 8 and 10 hours a day. I like to keep it and try and keep it at 8, but that doesn't always happen. But 8 to 10 would be typical.
Hi, my name is Brittany. I'm a certified occupational therapy assistant at Spring Hill Senior Residence. As an occupational therapy assistant, my typical day consists of therapeutic activities, therapeutic exercises, patient care. Typically, we just take care of the patients and work towards getting them as independently as possible so that they can go home and perform in their environment safely. A certified occupational therapy assistant, which is typically referred to as a COTA, can work in a variety of settings, including the school system, outpatient, hospitals, or, for example, where I work, the nursing facility. I can do a variety of things, including maybe one day I'll have a patient who's had a stroke and they need different types of care to address a side that may have lost its function. So we may work on getting in and out of bed or getting into a wheelchair, those type things. I may also have a patient who's had a knee replacement who typically functions very well but just has some weakness. So we're going to work on being able to walk back and forth to the bathroom or getting in and out of the tub. I may also have a brain injury who has difficulty remembering certain things. So we work on recalling information and reminiscing activities. The good thing about working in a nursing facility is the fact that it doesn't close. So you can somewhat make your own schedule. Typically, my hours are 8 to 4:30 because I like to get up, get in, and get out. The stress level of this job, honestly, is very minimal. It takes a lot of interpersonal skills to handle it, and with anything, it peaks, it has its ups and its downs. Sometimes you may have a demented patient who's somewhat difficult to deal with. So your stress level may increase. However, for the most part, it's very minimal.
Hi, my name is Megan. I'm a certified child life specialist in a pediatric hospital. I work with kids aging from
Hi, my name is Megan.
18,
I'm a certified child life specialist in a pediatric
a day in the
hospital.
life of a child life
I work
specialist
with
may
kids
include,
aging from
like I was
0
working with
to
a patient
18,
just
sometimes
recently, a
22.
child
And
who
a day in the
got
life
diagnosed
of a
with
child life
cancer.
specialist
She
may
had to then
include
get, Like I was working with a patient just recently, a child
special device in her
who
chest.
got diagnosed with
prepped
cancer.
her to understand
She had
what
to
that
then
was
get
and what she was going to
a port
experience,
place, which
where
is
she
a
was
line
gonna, what she was
or
gonna
a
see
special
along the
device
way.
in her chest.
So
I
supported
prepped her to
through that
understand what
procedure
that
by
was
going
and
to
what she was going
the
to experience, where she was going to,
area,
what she was going to see along the
providing
way.
toys.
I supported her through that procedure by going to the pre-operation area, providing distraction,
supported her
toys, or age-appropriate
activities
activities for her to do while she was waiting to go back
our
to
job
the
is
procedure,
helping families
and supported her until the anesthesiologist helped her go to sleep.
New procedures with
So,
the family. So it's not just for
our
the
job
children,
is helping
it is for the whole
families
family that we help
understand
support.
new
After that child,
treatments,
we then
new
had a group
procedures
come that
with the family.
was coming
So
to
it's not
pass
just
things
for the
out to all the
children; it
patients
is
on
for
the
the
floor,
whole
all the
family
kids
that
on
we
the
help
floor.
support.
And
After
so
that
taking them
child,
room
we
to
then
room
had a
to
group
pass out little
come
goodie
that
bags
was
to,
coming to pass
the
things
kids.
out to all the patients on the
And then
floor,
after
all the
that,
kids on the
we,
floor,
had an activity
so
scheduled in
taking
our
them room to
game
room to
room
pass out little goodie
to,
bags to
paint, and
the
we
kids.
painted with
And then
several
after
different,
that,
kids
we
that were here on the
had
floor
an
that could get
activity
out of their
scheduled
rooms
in
and
our game
enjoy our
room
facilities that we have
to
here.
paint, and we painted
Later,
with several
our
different
pet therapy
kids that
dog
were here on the
arrived.
floor that could
So
get out
again,
of
we
the
went back
rooms
through all
and
the
enjoy
rooms
our facilities
and,
that we have
let
here.
the children have some time with our pet therapy
Later,
dog that,
our pet therapy
just
dog
provides
arrived.
them
So
some
again, we went back
attention
through
and
all the
love.
rooms and let the children
Our
have some
volunteers are
time
here,
with
so
our
we
pet
help
therapy
assign
dog
them
that
to different places
just
to help
provides
with
them
kids
some
that I may not
attention
get
and
to
love,
or
and,
that may need some extra attention.
Our volunteers
There
are here, so we help
administrative duties
assign
where I
them
have
to
answer
different
emails or
places
phone calls to
to
schedule
help
those
with
groups
kids
that
that I
come
may not
in.
get to or that may need some extra attention. There are administrative duties where I have to answer emails or phone calls to schedule those groups that come in.